CDC Director Dr. Tom Frieden is with us from Atlanta. He is briefing President Obama on the Ebola outbreak today. Doctor, good morning.
Good morning.
Can you tell us the condition of Mr. Duncan and how he is being treated?
The patient in Dallas is critically ill, and we're really hoping for progress there in his care. What we have seen is that efforts of the Dallas and Texas State and CDC to track the contacts have been very well done. Every contact was identified and measured for temperature yesterday. None of them have symptoms or fever, and we're confident that if there are any secondary cases there, we can stop the chain of transmission.
Doctor, let me ask you, should the CDC now consider a plan to screen everyone coming from these West African countries?
Everyone is being screened when they leave the country. In fact, we know that the patient in Dallas's temperature was 97.3 when he left Monrovia. In fact, about 40,000 people have come in from those countries since the outbreak started, and none of them had fever from Ebola when they came in. But we will look at all opportunities to improve the safety of Americans, because that's what CDC does 24/7, is protect Americans. And one thing that's encouraging is some signs of progress in the outbreak. We've seen no more cases in Nigeria. It looks like they've stopped it. We've now trained 4,000 people across Africa, across these 3 countries in Nigeria, to fight Ebola, and we're seeing the first training here in the U.S. 60 people are going through training at CDC training in Anniston, and we're going to see those people deploy to Africa and join hundreds of people from around the country, around the world, who are responding to the outbreak. So definite signs of progress.
Is that your message to the president when you speak to him this morning, or is it more?
Well, we're going to be covering many aspects and figuring out what we can do to follow the president's orders to be forward-leaning and do everything we can to protect Americans and to stop the outbreak.
So when will you get more ZMapp?
Medications are going to be hard to find that work against this, Ebola. We're encouraged by some of the vaccine trials where there may be vaccines that are safe and effective, and we rapidly need to understand whether they work and then to get them into the field if they do.
So no panic as far as you're concerned?
Well, we need to understand that this is going to be a long road. It's not going to be easy, but we know how to stop Ebola, and I'm confident that we will.
Dr. Frieden, thank you so much.
Thank you.